I'd like to invite our next speaker, Dr. Poornima Prabhakaran. Poornima is the senior scientist at the Center for Chronic Disease Control in India and director of the Center for Health Analytics and Research Trends at the School of Biosciences, Ashoka University, India. Over to you, Poornima.
Good morning, everyone. Thank you, Ying. At the outset, yes, I would also like to appreciate the efforts by the capacity building subgroup of the WHO GCHA Civil Society Working Group in bringing this conversation to the Health Pavilion. I think it's an important one. I think we've come a long way advocating for a health COP in Glasgow to having this beautiful health pavilion, I think the third time now in this COP, and actually having a health day in COP28. But I think what we started talking about in the capacity building subgroup is what next? Of course, we need to empower our health professionals to do all of this, raise the health voice to bring health lens into all the climate policies. But what next? What can we do to further escalate this issue of empowering our health professionals and maybe move from talking to the converted, talking within this health pavilion and planting ourselves literally in every other pavilion in COP, because that's what is the most important next step in our opinion. So that's why I think this concept was conceived of talking about how do we integrate health into policies in other sectors. And I'll start, so in my talk in the next few minutes, I will actually bring experiences from India, where I come from. And like everyone else in all other countries, we did our bit as well to empower our health professionals. And both top-down and bottom-up approaches, which included actually taking cognizance of the fact that climate and health education is not a part of not just medical curricula, but curriculum in every other health sector, dentists, pharmacists, what have you. So I think we put in a lot of effort there, and thanks to those efforts over the last 3 years, we finally have our nodal ministry, the Ministry of Health and Family Welfare, Government of India, taking note of this request and actually have now constituted a subcommittee to look into curriculum change, not just in the Medical Council of India, but in 5 other councils, which includes the Dental Council, the Nursing Council, the Pharmacy Council, and the Indian Systems of Medicines. So I think that was a big first step for us, but we've only just started and we've had a couple of meetings. And I think we are hoping that this change in curricula happens at least in the next year or so. Of course, in that interim period, we are continuing to focus on practicing doctors, nurses, and health professionals. So wherever we've had the opportunity, we have convenings of physicians, cardiologists, pediatricians. They all have their own bodies and conferences. So we put in every effort we can to win a session in their conference so that we start, endearing ourselves and our conversations to these groups of health professionals and professionals within the health sector. So we've done a lot in the last few years to talk to different people, obstetricians, pediatricians, cardiologists, pulmonologists. Not that they are not aware, they are seeing it in daily practice, but maybe they don't draw the links to climate change. Of course, taking it out to social media at every opportunity that we can, and even within the National Program for Climate Change and Human Health that our Ministry of Health has, we've developed a lot of resources that we've taken down to the lowest level of healthcare, health actors on the ground. Because in India, it's not like the NHS in the UK. We have a very diverse health system, both the public as well as the private healthcare networks. So it's a huge task dissipating this message and taking it down to the ground. So we have done everything that we can to talk to the health sector. But what next? And like I said at the outset, we started recognizing that we need to bring this health narrative, this health lens into climate policies in the non-health sectors and draw those linkages for these people who are making the climate policies in, for example, in the energy sector, the diet and food systems, the transport, because it's so important for them to recognize that health has to be at the center of all their policies. So I didn't know where to start, but I fell back on this resource that was, the Health and Climate Network was a platform that was funded by the Wellcome Trust, I think a couple of years ago. And through this platform, which is directed by Dr. Alison Doig, and what they started talking about there was exactly this. How do we talk to the other sectors? And I think within that network, in the couple of years that it lasted, I think a big push was made to bring these conversations to the other sectors. And we had like 4-hour workshops, one with the diet and food systems actors, people, only experts from that domain, in the same room with health professionals. And what happened at the end of those exercises was that we ended up having these policy briefs, one on diet and food systems, one on transport, one on energy, and one on health systems itself, because this was important. How do we actually, what resource can we have to take these conversations as healthcare professionals forward? And this came up with a set of recommendations in each of these domains. So if I was talking to an energy system professional and he or she were to ask me, so how do I bring health into my conversations? There were these set of recommendations. I'm not going to read through all of that, but those were recommendations that came out of each of these conversations and dialogues. And thankfully, again, with funding from Wellcome Trust, we were able to win these little grants to take these conversations to national level. So I was fortunate to have one of these grants, and so decided to take this resource into India and do exactly the same thing, replicate that exercise at national level. So I convened a series of workshops where I brought actors one at a time, the energy people, the transport people, the food systems people, and started asking them these questions in those conversations. And I had the health sector people sitting there as well and listening to them. So we first understood what the policies were in their sector in India. So asked them questions on what's the current state of policies for you in the food systems thing. Are you thinking of health at all? Do you think it's linked? And what do you need for us to do to help you integrate that health lens into the policies that you make? So if I were to pick the transport sector, and I want to advocate for cycling, of course, I had to have the urban planners as well listening in, because cycling paths will not happen just by the transport sector, as saying this modal shift has to happen from using private vehicles to bicycles or even public transport. So we started having these conversations first with the sectoral experts, and then we did a national convening where we had all of them in the same room and really forced them to sit together and talk to each other and learn from the different sector experts what the health sector can do to help them along. Do they need research evidence? Do they need us to give them some policy talk, give them some whatever inputs they required in terms of nudging their sector to take health into account? And I think that was a very good exercise, very good deliberations, and a lot came out of that, which gave us food for thought. And what we should do next to empower our health professionals to stay in those conversations and take it forward. And so I'll really end with those key takeaways. So while we empower our health professionals and help them to bring the health lens into climate policies in our sectors, but also in other sectors, we need to do both the bottom up as well as the top down approach. Engage with the national governments, engage with health ministries or environment ministries, and push this conversation for health in the climate agenda, but also continue to do what we can bottom up, talk to all the different sectors. Next COP, maybe we should all be sitting in the energy pavilion or the food systems pavilion and pushing our conversation for the health lens. And at every stage of policy making, I think it's important to bring that importance of linking energy policies to health. We are doing a lot for phasing down and phasing out of fossil fuels. But what about diet and food systems? We talk about the global syndemic, which is a linkage between the entire spectrum of malnutrition, undernutrition, but because of climate change, rising temperatures, the impact on our food systems, our crop production, and people are probably forced to move to processed foods, and then the other end of the spectrum of overweight and obesity. So these three pandemics of undernutrition, overnutrition and climate change. We are a classic example in India. We are facing both of these malnutrition scenarios along with climate change. We figure among the top 10 countries if we're looking at the global climate risk index in terms of vulnerabilities. So we have a lot of homework to do, and we're really grateful for the lessons that we learn in these dialogues over here. But I think I'll close with the statement, what we call our mantra: health in all policies must be the way forward. Thank you.
Thank you. Thank you, Poornima, and I should congratulate you on the achievement. As we know that how hard it and how much it takes to influence national politicians and achieve what you have done so far in India. Thank you. And all the key questions that you posed there, just for us to just start the conversation with non-health people to lead the change.